Hello, everyone. This is Brunetti, and this is my presentation of mental health after a stroke, specifically discussing post-stroke depression. So, what is mental health, and how are we going to define it for the purpose of the presentation? So, I'm defining mental health as a state of well-being and the ability to cope with stressors in our everyday lives. So, what this basically means is how are we able to handle those intrinsic and extrinsic stressors that occur on a day-to-day basis, and how do they impact our ability to navigate our daily activities? This is the main idea of what mental health is, and understanding it for the purpose of this presentation is going to help with clarity as we continue onward. So, what is post stroke depression? Post stroke depression is a type of depression that is catalyzed by a stroke, and it can occur at any time. So, post stroke depression differs from other forms of depression because it is only occurring after the events of a stroke. So if an individual has depression before a stroke and has a stroke following, and that depression maintains or becomes worse, the individual has post stroke depression. Or the individual may not have depression before, but then after a stroke, they develop depression, that it becomes post stroke depression. Additionally, this can occur at any time. There is no set time when an individual may have post stroke depression. They may never have post stroke depression, but research shows that about 1 to 3 months following a stroke, an individual typically develop post-stroke depression if they're going to. This is, of course, not true for everyone. Some individuals may develop post-stroke depression a year after or 5 years after. There is no set timeline on when this can occur. Additionally, it's important that we understand the difference between depression and anxiety because a lot of the time they are grouped together and individuals think they are very similar. And although they can occur at the same time, they are very different things. So, anxiety is a constant fear or worry of the unknown or a specific situation that makes an individual nervous, neurotic, anxious, fearful of something happening. Whereas depression is less feelings of anxiousness and more so feelings of disinterest, lack of meaning, lack of desire, this overall feeling of sadness or melancholy that persists. And so post-stroke depression impacts about a third of stroke survivors. And this is a very staggering number, and it's an important number to recognize so that we have an understanding that when we are working with stroke survivors, that we're aware that a third of stroke survivors that we're going to come across can potentially be battling post-stroke depression. So, what are the causes of post stroke depression? Well, post stroke depression occurs primarily because of the lasting effects or impacts that a stroke brings upon an individual. So, these can include our loss of bowel and bladder control, loss of sexual fulfillment, loss of functional movement or engagement, loss of engaging in meaningful activities, challenges with communication or expression, and then, of course, changes within our brain chemistry and emotional regulation are all things that can lead to post stroke depression. So, we're going to talk about the symptoms of post stroke depression. Before I get too far into this, I do want to emphasize that this is not a diagnosis presentation. I'm not diagnosing any individuals with post stroke depression as they go through this presentation. That, of course, needs to be done by a licensed physician or psychologist, psychiatrist. But this is just helping provide education so that you may have some education or understanding to maybe have that conversation with your physician or doctor or help somebody that you know with post stroke depression. Additionally, the reason I have this capitalized persistent is that I want to emphasize that these symptoms I'm going to list are persistent and occurring more often than not. Because a lot of these that you'll see, you might think, well, I have these feelings, sometimes. Does that mean I have post stroke depression? Well, no, because a lot of these symptoms that we're going to see are typical feelings of the human experience. The point is that these are occurring persistently and they're disrupting and causing dysfunction to daily activities. So the first one is hopelessness and sadness. And that just as it sounds, individuals have this loss of hope, this overwhelming feeling of sadness. This can be because they don't feel like they have meaning in their lives or they feel like they lost their purpose. So this kind of overwhelming sense of sadness that overtakes their days. Another one is self criticism and guilt. That can look like negative self talk, feeling guilty for your stroke, or feeling that you had a stroke because of certain behaviors or characteristics that you had before the events of your stroke, which we know is just not true. A stroke is not a punishment for individuals' behaviors, but these kind of feelings of negative self-talk and feelings that an individual deserves what they have um, persist and can overwhelm individuals. Another is lack of interest in meaningful activities or withdrawal from loved ones. Individuals become isolated. They isolate themselves from the activities they once enjoyed. They isolate themselves from loved ones and kind of become reclusive. This is very common with individuals with post-stroke depression. Another is changes in sleep and appetite. These can occur in two extremes. An individual can be getting very little sleep, or they can be getting large amounts of sleep, but when they, regardless of the amount of sleep they're getting, they don't feel rest. They don't feel rested, or they don't feel like they have any energy. Another is appetite. Again, can go one of two ways. They can have lack of appetite, or they can have a large appetite, and they're either eating a lot or they're eating very little, but they still feel very little fulfillment from eating. Another is thoughts of self harm. This can be just thinking of self harm. This can be persisting and performing self harm. But these overwhelming thoughts and feelings of needing to punish oneself, whether that be physically or mentally, for their present situation, can commonly occur within post stroke depression. So, how do we combat post stroke depression? Because we talked a lot about what it looks like and how to recognize it, but how exactly do we help mitigate this? So I like to discuss it as the four M's, which is movement, mindfulness, meaningful engagement, and mastery, which I will go over each of those in more detail. Movement is just as it sounds. It's getting up, exercising, doing activities on an active basis. This can be doing, you know, cardio or strength training, and it can be movement as, large as that, or it can be even as little as getting up from the living room and taking your plate to the kitchen, or getting up and taking a shower this day. But making sure that you're not staying sedentary and that you're up and moving and staying engaged is very important for our mental health. Mindfulness, this can again look like meditation, but it doesn't always have to be. Mindfulness can be just taking in the present, going on a walk, and just very living in the moment. Because with post-stroke depression, it's easy to get in a vicious cycle and to kind of go downhill and just get very overwhelmed and just pile on one on top of the other and get ahead of yourself. Where if we're mindful, we stop that persistent feelings of negative self-talk and that vicious cycle, and we're in the present, and it kind of provides that relief, and that kind of gets rid of that overwhelming snowballing effect that can occur with post-stroke depression. Meaningful engagement, so engaging in activities that you found meaning in before, or finding new activities that you find enjoyment in. Often with a stroke, it can be challenging to find that activity you did before, the same pleasure from those, or finding a hard time to complete them as you did before. So trying to find adaptive ways to complete those activities. If you don't get the same meaning out of doing it through a different way, finding new activities that you can engage in that provide you meaning is important. There are so many hobbies and activities out in the world that are just waiting for your skills and talents that hopefully you can find meaning and importance in as well. And then mastery is just a culmination of the three, where you are completing those three on a daily basis and you're actively working to make sure that you're staying active, you're remaining mindful and present, and that you're still engaging in things that you find enjoyment in on a daily basis is what mastery is. So making sure that you're constantly doing things that are beneficial for you and your mental health. So we've talked about what it looks like, what it might be if you have it, ways to combat it, but how can you help if you don't have it, if you've overcome it, or if you're a loved one or a caregiver who has somebody with post-stroke depression? Well, the best way to help is by listening. And the best way to listen to understand and not to respond. Making sure that we're letting the individual talk, have that space, speak about what's on their mind, let them guide the conversation, don't force the narrative. Checking in on individuals, sending them a text message, a phone call, an email, driving by, anything that helps them feel seen, loved, and noticed is going to be very important post stroke depression so they don't have those feelings of isolation. And just letting you know that you care about them and that you're here for them can be very beneficial in helping combat post stroke depression. So, some intervention ideas include healthy eating. As we know, eating healthy is important not only for our physical health, but it's also important for our mental health. So, making sure that we're eating food that nourishes not only our body, but our minds as well. And again, everything is good in moderation. There are no specifically bad foods, but just making sure that we're eating a healthy amount of foods that are good for us is very important, and making sure our mental health stays active and well. Journaling and checking in is another great way to help with mindfulness and recognizing potential negative patterns in our thoughts and behaviors. So, whether that be journaling in every day, doing voice memo journals, having a mood board, having mood check ins, but just anything that helps you list how you felt that day, what your feelings were, what your thoughts were, in a way that you can go back and recognize if you're having continuous days of negativity, or if you're having continuous days of positivity, and recognizing here's what I did on these days that I was feeling positive. And so maybe I want to keep doing this to try to maintain that. Or here's what happened when I had 3 negative days in a row. And here's a common theme I found. I need to change X, Y, or Z. It's beneficial in just kind of helping make sure that we don't fall into the negative patterns. Music's another wonderful method. There's tons of research out there that shows the benefits of music. So just listening to music, performing music, dancing, singing, anything that gets your mind active and helps kind of get us thinking, and potentially helps put words that we can express ourselves into how we're feeling is very beneficial in helping us feel that we're not alone, or that we feel seen. So making sure that you just engage in music in ways that are beneficial for you. And then discussing feelings and emotions. So talking with individuals about how you're feeling, not keeping it bottled up. Society can often make us feel that if we share too much or we're vulnerable, that we're weak. And that is just simply not true. There is strength and bravery in being vulnerable about our mental health and discussing how we're feeling. So, not only is it brave to do so, but it's important, as we put words to our feelings, we're not giving them as much power. So making sure that you're talking to an individual and saying, this is how I feel, and this is why I think I'm feeling this way, is going to help you identify possibly why you're feeling a certain way. And then lastly, medication is another intervention possibility. Talk with your physician about possible medications that work for you. But I would like to emphasize that there is no happy pill. Medication for depression or in post-stroke depression is not a pill that you take and you wake up the next day and you're just happy and those feelings are gone. It just helps make reaching that baseline easier. So it's still important that you engage in those 4 M's of movement, meaningful engagement, mindfulness, and mastery to help make your medication work the best that it can. So that is it for my presentation. Just for questions and discussion, things I'd like you guys to think about at the close of this discussion is just how are ways that you could reach out and help individuals with post-stroke depression. If you are living with post-stroke depression, what are some things that we discussed here that you found could be a benefit? What are things that you're doing presently, maybe in this discussion, that you found to be beneficial? And then maybe if you're having some of these similar feelings and you feel like this could be something you are living with, making sure that you reach out to your physician, talk to your family, so that you can get the proper help and care that you need. Thank you so much.